Trances for Histology from Dr. Estelia's lecture on diseases of infancy and childhood. Stages of development. You have for children, diseases are not merely variants of adult diseases. Diseases originating from perinatal period account for significant morbidity and mortality. Each stage of development is prey to somewhat different group of date of birth. Okay, for courses younger than 1 year, you have congenital malformations, deformations, and chromosomal anomalies. Disorders related to short gestation and low birth weight. You have sudden infant death syndrome. You have newborn affected by maternal complications of pregnancy, accidents like for unintentional injuries, newborns affected by complications of placenta, cord, and membranes, bacterial sepsis of newborn, respiratory distress of newborn, diseases of the circulatory system, and neonatal hemorrhage. For 1 to 4 years, you have your accidents for unintentional injuries, congenital malformations, deformations, and chromosomal abnormalities. You have your assault for homicide, malignant neoplasm, and diseases of the heart. For 5 to 9 years old, you have your accidents, malignant neoplasm, congenital malformations, deformation, and chromosomal abnormalities, assault, influenza, and pneumonia. For ages 10 to 14 years of age, you have your accidents, malignant neoplasm, intentional self-harm or suicide, assault, congenital malformation, deformation, and chromosomal anomalies. Leading causes of death in infancy and childhood. For neonatal period, that is the first four weeks of life, it is the most hazardous time. For infancy, it is the first year of life. It is once infant survives first year of life, increased survival outlook. It poses the highest risk of death is in infancy. For 1 to 4 years old, 1 to 4 years old and 5 to 9 years old, most leading cause of death is unintentional injuries from accident. For 10 to 14 years of age, you have leading cause of death is accidents, malignancies, suicide, homicide, and congenital malformation. Between 1 and 14 years of age, injuries resulting from accidents are the leading cause of death. Congenital anomalies, anatomic defects that are present. Congenital anomalies are anatomic defects that are present at birth. Some, such as cardiac defects, renal anomalies, and renal anomalies may not become clinically apparent until years later. Congenital means born with. It does not imply or exclude a genetic basis for birth defect. It is an important cause of infant mortality. And perhaps 20% of fertilized ova are so anomalous that they are blighted from the outset. Spontaneous abortion. Different errors in morphogenesis. Malformation, it represents primary error of morphogenesis in which there is an intrinsically abnormal developmental process. Malformations can be the result of single gene or chromosomal defect, but are commonly multifactorial in origin. It may be present in several patterns. Examples: congenital heart defects, anencephaly, or the absence of brain, anencephaly, which is involve single body system, triple malformations involving many organs and tissues. For disruptions, it is a result from secondary destruction of an organ or body region that was previously normal in development. It arises from an extrinsic disturbance in morphogenesis. Classic example is amniotic bands, denoting rupture of amnion with resultant formation of bands that encircle, compress, or attach to parts of developing fetus. Multifactorial is environmental. It is not heritable and hence not associated with the risk of recurrence in subsequent pregnancies. Deformations represents an extrinsic disturbance of development rather than an intrinsic error of morphogenesis. It is common, affecting approximately 2% of newborn infants to varying degrees. Pathogenesis is localized and generalized compression of growing fetus by abnormal biochemical forces and leads eventually to a variety of structural abnormalities. It is most common underlying factor responsible for the deformity is uterine constraint. Between the 35th and 38th week of gestation, rapid increased size of fetus outpaces the growth of the uterus. Relative amount of amniotic fluid, normally access quotient, also decreases. Another one is maternal factor, which includes the first pregnancy. So you have your small uterus, and then you also have malformed or bicornuate uterus. The mother has leiomyomas. Lastly, fetal or placed placental factors included oligohydramnios, multiple fetuses, and abnormal fetal representation. Example is club feet. Now, sequence. It refers to multiple congenital anomalies that results from secondary effect of a single localized aberration in organogenesis. It is a cascade of anomalies triggered by one initiating aberration. It occurs when the primary anomaly itself determines additional effects. Example: oligohydramnios or Potter sequence is where facial appearance, lung hypoplasia, and joint contractures are all the result of constraint due to insufficient amniotic fluid or due to renal anomalies and or urethral valves. Fetal compression is associated with significant oligohydramnios, which result in a classic phenotype in newborn infant, including flattened faces and positional abnormalities of hands and feet. Hips may be dislocated, and growth of the chest wall and contained lungs is also compromised, so that the lungs are frequently hypoplastic, occasionally to the degree that they are the cause of fetal demise. Nodules in amnion or amnion nodosum are frequently present. Malformation syndrome, a constellation of congenital anomalies believed to be pathologically related. In contrast to sequence, it cannot be explained on the basis of a single localized initiating defect. It is most often is caused by a single etiologic agent, such as a viral infection or specific chromosomal abnormality, which simultaneously affect several tissues. Definition of terms applied to organ-specific malformation. Agenesis refers to complete absence of an organ and its associated primordium. Aplasia refers to the absence of an organ, but one that occurs due to failure of growth of existing primordium. Atresia describes the absence of an opening, usually of a hollow visceral organ such as trachea or intestine. Hypoplasia refers to incomplete development or decreased size of an organ with decreased number of cells. Hyperplasia refers to the converse, enlargement of an organ due to increased number of cells. An abnormality in organ or a tissue as a result of an increased or decreased size rather than number of individual cells defines hypertrophy or hypotrophy, respectively. Dysplasia is the abnormal organization of cells. Causes of congenital anomalies. Exact cause remains unknown in at least 1/2 to 3/4 of cases. Common known cause can be grouped in 3 major categories: the genetic, environmental, and multifactorial. Genetic. Virtually all chromosomal syndromes are associated with congenital malformations. Example: Down syndrome, Turner syndrome, Klinefelter syndrome. And most chromosomal disorders arises during gametogenesis and hence are not familial. Single gene mutations characterized by Mendelian inheritance may underlie major malformation. Example: Holoprosencephaly is the most common developmental defect of forebrain and midface in humans. Hedgehog signaling pathway plays a critical role in the morphogenesis of these structures, and loss of function mutations of individuals' components within this pathway are reported in families with a history of recurrent holoprosencephaly. Environmental. Viral infections, drugs, irradiations to which the mother was exposed during pregnancy may cause fatal anomalies. Maternal infection with Zika virus can give rise to severe malformations of the central nervous system. A variety of drugs and chemicals have been suspected to be teratogenic, which is less than 1% of congenital malformation. Thalidomide, used as tranquilizer and treatment for cancer, can cause limb malformation. Alcohol, when consumed even in modest amounts during pregnancy, is an important environmental teratogen. Affected infants show prenatal and postnatal growth retardation, facial anomalies like microcephaly, short palpebral fissures, maxillary hypoplasia, and psychomotor disturbances, due to which can cause fetal alcohol syndrome. Diabetes mellitus, 6 to 10% incidence of malformations Maternal hyperglycemia induced fetal hyperinsulinemia results in fetal macrosomia, organomegaly, and increased body fat and muscle mass. Cardiac anomalies, neural tube defects, and other CNS malformations are some of the major anomalies seen in diabetic embryopathy. Multifactorial. Most common genetic cause of congenital malformation implies interaction of environmental influences with two or more genes of small effect. Included in this category are some relatively common malformations such as cleft lip, cleft palate, and neural tube defects. Dramatic reduction of incidence of neural tube defects by periconceptional intake of folic acid in diet of pregnant women. Okay, examples for environmental, you have your rubella, toxoplasmosis, syphilis, cytomegalovirus, human in HIV. For maternal disease states, you have your phenylketonuria, endocrinopathies, and diabetes. For drugs and chemicals, you have alcohol, folic acid antagonists, androgen, phenytoin, thalidomide, warfarin, 13-cis-retinoic acid, and others. Okay, the timing of prenatal teratogenic insult has an impact on the occurrence and type of anomaly produced. The intrauterine development of humans can be divided into two phases. First, embryonic period occupying the first 9 weeks of pregnancy, and second, a fetal period terminating at birth. Between the 3rd and 8th weeks, embryo is extremely susceptible to teratogenesis. Fetal hydrops. It refers to the accumulation of edema fluid in the fetus during intrauterine growth. The degree of fluid accumulation is variable, from generalized hydrops fetalis to localized cystic hygromas. Hemolytic anemia caused by Rh blood group incompatibility between mother and fetus was the most common cause. The most common cause of fetal hydrops are non-immune, which are chromosomal abnormalities, cardiovascular defects, and fetal anemia, whereas immune hydrops has become less frequent as a result of Rh antibody prophylaxis. Erythroblastosis fetalis, which is circulating immature erythroid precursors, is a characteristic finding of fetal anemia associated hydrops. Hemolysis-induced hyperbilirubinemia can result in bilirubin toxicity or kernicterus in the basal ganglia and brainstem, particularly in premature infants. Immune hydrops is a hemolytic disease caused by blood group antigen incompatibility between mother and fetus. Major antigens known to induce clinically significant immunologic reactions are certain of the Rh antigens, especially the D antigen and ABO blood group. Reaction occurs in second and subsequent pregnancies in an Rh negative mother with an Rh positive father. Etiology and pathogenesis. Immunization of the mother by blood group antigens on fetal red cells and free passage of antibodies from mother through placenta to the fetus. Initial exposure to Rh antigen evokes formation of IgM antibodies that, unlike IgG antibodies, do not cross the placenta. Rh disease is uncommon with first pregnancy. Exposure during subsequent pregnancy generally leads to a brisk of IgG antibody response at the risk of immune hydrops. Only D antigen is a major cause of Rh incompatibility. Hydrops fetalis represents the most severe and generalized manifestation, and lesser degrees of edema, such as isolated pleural, peritoneal, or postnatal fluid collection can occur. Accordingly, infants may be stillborn, die within the first few days, or recover completely. Presence of dysmorphic features suggests a chromosomal abnormality. Postmortem examination may reveal an underlying cardiac anomaly. Inborn error of metabolisms and other genetic disorder. Inborn errors of metabolism are well-characterized genetic abnormalities that give rise to metabolic disorders. The most inborn errors of metabolism are rare diseases that are generally inherited as an autosomal recessive or X-linked trait. Okay, for autosomal suggesting inborn errors of metabolism, you have for general, you have dysmorphic features, deafness, self-mutilation, abnormal hair, abnormal body or urine odor such as sweaty feet, mousy or musty, and maple syrup, urine odor, hepatosplenomegaly or cardiomegaly, and hydrops. For neurologic, you have your hypotonia, hypertonia, you have coma, persistent lethargy, and seizures. For gastrointestinal, you have poor feeding, recurrent vomiting, and jaundice. For eyes, you have cataract, cherry red macula, dislocated lens, and glaucoma. For muscle joints, you have myopathy and abnormal mobility. Now, for phenylketonuria, 1 in 10,000 live-born Caucasian infants. It is the most common form referred to as classic phenylketonuria is quite common in persons of Scandinavian descent and is distinctly uncommon in African American and Jewish population. It is an autosomal recessive disorder caused by a severe deficiency of an enzyme phenylalanine hydroxylase or PEH and results in hyperphenylalaninemia. It is part of the newborn screening test in the Philippines. Affected infants are normal at birth but within a few weeks develops a rising plasma phenylalanine level which impairs the brain development. Usually by 6 months of life, severe mental retardation becomes evident and fewer than 4% of untreated phenylketonuric children have IQs of greater than 50 or 60. About 1/3 of these children are never able to walk and 2/3 cannot talk. Seizures and or other neurologic abnormalities, decreased pigmentation of hair and skin, and eczema are often accompanied by mental retardation in untreated children. Hyperphenylalaninemia and the resultant mental retardation can be avoided by restricting phenylalanine intake early in life. Okay, for next is galactosemia, which is an autosomal recessive disorder of galactose metabolism resulting from accumulation of galactose 1 phosphate in tissues. It is also part of newborn screening in the test in the Philippines. Lactose is the major carbohydrate of mammalian milk and it is split into glucose and galactose in intestinal microvilli by lactase. 2 variants of galactosemia have been identified. In the more common variant, there is a total lack of galactose 1 phosphate uridyl transferase or GALT involved in reaction 2. A rare variant arises from deficiency of galactokinase involved in reaction 1. The liver, eyes, and brain bear the brunt damage. Opacification of lens or cataract develop, and nonspecific alterations appear in CNS, including loss of nerve cells, gliosis, and edema, particularly in dentate nuclei of cerebellum and olivary nuclei of the medulla. Symptoms appear: failure to thrive almost after birth, vomiting and diarrhea appear within a few days of milk ingestion, jaundice and hepatomegaly usually becomes evident during the first week of life, physiologic jaundice of newborn and cataracts within a few weeks, and mental retardation within the first 6 months. Accumulation of galactose and galactose 1 phosphate in kidney impairs amino acid transport, which leads to aminoaciduria. There is increased frequency of fulminant Escherichia coli septicemia, which is possibly due to depressed neutrophil bactericidal activity inherent to infants with galactosemia. Hemolysis and coagulopathy in newborn period can occur as well.